what's going to happen? Do you expect more? So we got two fronts with the Affordable Care Act. One is continuing problems with the website. They've shut it down. My understanding is last night. It may be able to be back up today, but they keep shutting it down to do some fixes. And they've given themselves as a November 30 as a deadline to get the website fixed. And then compounding that, we've got the problem where a certain number of Americans are, in fact, who have health insurance on their own, bought it on their own, are going to lose those plans because they don't meet the test of Obamacare, and they're going to have to buy another plan. And unless they qualify for federal subsidy, some of them may end up paying more. Some will pay less. But you got that problem as well. What's going to happen on the Hill? They're going to delay it. They're going to kill it. They're going to have more hearings, or what do you think?
Well, they won't be successful in killing it or delaying it, certainly. I think...
haven't been so far.
They haven't been so far.
They certainly tried.
They tried. Honestly speaking, I think with Republicans, especially because of how they went about it, shutting down the government over the health care law, they've lost their standing to challenge even elements of the law that perhaps they would have been able to get some Democrats on board with in any other venue if they had just been patient.
Yeah, the shutdown really...
They could have looked for a delay after they resolve funding for the government and after they raise the debt limit. It wouldn't mean they would get a one-year mandate delay, let's be clear.
Yeah.
The administration has adamantly ruled that out. But they could have certainly looked for other fixes. But the problem is that Republicans don't actually want to fix the law. This really is for them continues to be their primary political target. And this is all about 2014. It's all about proving that this law is a disaster, although they still haven't been able to make the case that it is. I think in the longer scheme of things, this looks bad for the administration, of course, in the short term. And it will be a problem for them if they can't get the website up and running. Certainly, people do feel misled by the fact that they didn't know some of them would have to change their plan or potentially lose their plan and get one through the exchanges that they weren't planning on doing. But at the end of the day, in the longer scheme of things, I think that as long as they are able to get past these initial few months and the law is implemented as it was intended, that's where Republicans haven't figured out how to address that, because the law isn't going anywhere. Eventually, it's going to work.
Yeah,
it's
here to stay.
It's here to stay, and it's a comprehensive law. That it was expected that the first few months, even the first year, potentially, maybe the first couple of years, will be rocky. That's just the reality when you're doing something this sweeping, a landmark piece of healthcare.
It was true of Social Security. It was true of Medicare. It's true of Obamacare. The New York Times reports, and I think the administration has not done a good enough job of getting this word out, is that so these people who are losing their plans, right? These are plans that weren't worth a damn to begin with, right? They were plans that certainly did not meet the test of basic quality care, which the Affordable Care Act sets out. The Times yesterday in its editorial pointed out that some of these plans had deductibles as high as $10,000 or $25,000, required large co-pays after that, and some of them didn't even cover hospital care. So these people had a worthless piece of paper, and the insurance companies have to drop those. And so they have to get another plan through the exchange. And with the exchange, subsidies are available for a lot of these people. So it doesn't mean that they'll necessarily pay less.
Absolutely. And
pay more.
Pay more.
Right.
It just depends, of course. And that's kind of the way that health insurance works anyway. That's another argument that's been brought up. Every year, an insurance company will make changes to your plan. They will raise your premium. They might say now that they're offering a new plan that offers more coverage. Perhaps they'll say now your deductible might go down a little bit, but that means you'll have to pay more by the month. There are always changes every year to people's insurance plans, whether they like it or not, and the premiums do go up. It doesn't mean that, of course, it's ideal for people who might not need a lot of the coverage provided under Obamacare, but that's also sort of how it works. There's a lot of stuff in your insurance plan that you might not need. It sounds like for some people, what they had was the bare minimum plan that they could have in order to just go to the doctor, in order to just possibly be prescribed medicine and have some sort of copay rather than paying out of pocket. But you have a couple of interviews you've seen in recent weeks where people are upset because they'll say things like, well, I don't need hospital care. I don't need mental health coverage. I don't need prenatal. And sure, you might not. If you're a male and you're not married, you might not need prenatal. You might not need mental health coverage, but there are other elements there that will be worth it, especially if you didn't even have hospital care covered.